Dr. Trish Leigh. I'm here to tell you what worry does to your brain. This is based on a study by Oaths et al. From 2008, and I'm borrowing the graphic so that I can use it to interpret how worry impacts your brain. Now, I know most people don't love science like I do, but we're going to use it anyways because it proves our points. So what this shows is that at the areas of the brain that are associated with emotional regulation, so we have T5 and T6 and P3 and P4 in the more posterior area of the brain, how they are impacted by, first of all, overall anxiety, and secondly, induced worry. So these columns here, the pre and the post, are people with anxiety disorder versus a control group, people who don't suffer from anxiety. What we see here is in the, not what I want to do. Hey, it's Dr. Trish Leigh, and I'm here to talk to you about what worry does to your brain and how your brain performance mode impacts how you feel worry. So I'm borrowing this graphic from a research study by Oaths et al. On worry and generalized anxiety disorder from 2008 because it shows some really awesome points that I would like to convey. So the areas that are listed on this graph are P3, P4 back here in the posterior area of the parietal lobe, and the temporal lobes at T5 and T6. These areas are associated with emotional regulation and negative thoughts. So what this study shows, and you can see here in our legend, we have pre, post, and a control group. So essentially the charcoal bars are people who have anxiety disorder before they engaged in any type of therapy. The black line is people with anxiety after therapy, and the gray bar is people who don't suffer from anxiety at all. So what we see here at all of the areas of the brain is that gamma, extra fast speed, is being used excessively in all of these areas compared to a control group. So what this means is the areas of the brain that are involved in emotional regulation are much higher in extra fast worry speed during an induced activity where worry was brought on. So why might that happen? We know from other scientific studies that people who suffer from anxiety have overall excessive amounts of extra fast speed high beta. So then when something is given to their brain to chew on and worry about, they get into gamma, which is even faster speed, and start chewing away because their baseline levels are higher than if they were at appropriate levels. What the study also shows is that after therapy, those gamma levels were reduced during a worry induction activity, but they're still higher than control groups, people who don't suffer from anxiety. So what does this show us? As neurofeedback practitioners, it shows us to expect a lot of high beta in a person's brain that is using this excessive fast speed, and especially if they report worrying, we know that during instances of worry, their brain is going to kick it in even faster into an even higher mode of gamma. We also know that tips and strategies and techniques that are used in therapy can help bring those levels down. And we know from other scientific studies that neurofeedback will shift that baseline down. Okay, so I hope this graph helps you to understand what worry does in the brain, how your brain plays a role in worry, and how overall anxiety levels can really make worry worse for people. Okay, so remember, control your brain or it will control you.